Bariatric surgery and weight reduction surgeries are one of the most effective procedures currently for weight loss. Of course, the surgery always has its complexity of adverse events and some of the associated adverse events, not every procedure, and also the length of stay in the hospital. Hence, gastroenterologists and endoscopists per se, started trying to find the benefit of the weight reduction through the surgery that emulated to a minimally invasive endoscopic surgery. The procedure is called ESG, which is Endoscopic Sleeve Gastroplasty, which is essentially performing an endoscope procedure with certain suturing devices trying to lessen the volume of the stomach through the scope by 70%. There are several reasons for the gastroenterologist and the patients to like ESG. One, the volume of the stomach will be, as mentioned earlier, reduced by about 70%. Also, studies have mentioned that the food of the stomach will stay in the stomach for a longer period, but the emptying of the stomach will be less, hence the patient will not eat. And other studies also mention that the ESG itself can affect the hormonal issues and reduce the weight furthermore. What is this video going to show you is that patients will be sedated. We go through the scope, with the scope through the mouth to the stomach. We mark the areas from the back to the front. We try to lessen the size of the stomach by about 70%, and at the same time we're going to lessen the length of the stomach itself. The difference between this procedure and the surgical procedure is purely endoscopic procedure. The length of the stay around 1 to 2 up to 3 days. And the procedure takes about 90 minutes to 120 minutes. And other patients who have comorbidities such as diabetes, such as inability to do exercises, in addition to patients who have criteria do not fit bariatric surgery. So the endoscopic option is suitable for them. The studies have suggested that patients the first 6 months lose around 50% of the excess weight, and in a year's time around 60% of the excess weight. Don't forget, it's not only about weight reduction, also it's affect them from blood sugar point of view. So patients with diabetes have reduced their medication from 4 tablets to 1 tablet. Patients with blood pressure management uncontrolled, this has become better. Patients with sleep apnea also has become better. Last but not least, at Mediclinic Parkview Hospital, we have the weight reduction team, which is coordinated by the dietitianist, in addition to have in the meeting the endocrinologist, the surgeons, and the gastroenterologist, in addition to the sport medicine doctor, and this discusses which preferable procedure for the patient.